Hey Bree, so we're sitting on this really green car.
Yeah, and I mean, like, it's close enough to pink, right?
I would say so.
I think green's pretty close to pink.
It's like a watermelon is green on the outside, but
Pink. It's red, but like pink on the inside.
it's close enough. That was really close. I like that.
Really close.
On the inside, this car is probably reddish pink.
All right, that works. But why do we care about pink so much?
Because we talked to Miss Dampf about her breast cancer.
Because it is Breast Cancer Awareness Month, so we made sure to talk to Miss Dampf about her experience and what she went through. So we have a really great interview. I did it, so we all should go check it out. Hi, I'm Brianna Kelly here talking to Miss Dampf about breast cancer awareness and what it has to do with her life. Thank you for being here today.
You're welcome.
So what's your relation to breast cancer? How did it affect you?
In August of 2012, I was in for a mammogram, and the doctor was there because they'd been monitoring something different for a while, and he said, "Come back, we need another mammogram. I don't like what we see." And so I had another mammogram, and then they said, "Let's do an ultrasound" that very day. And at that moment, laying there, that was the horrible words that said, "Doesn't look good." So then I had to go for further tests. I had to get a biopsy, and that was the day that after the biopsy, within a week, I had the results to say, yes, in fact, it is breast cancer. When I first went to the doctor in Paoli, he said, "This is so tiny, we can do it, we can take care of it with a lumpectomy, unless you want to go for the gold and get a mastectomy," which can happen too, but you're not a candidate. And that was when I decided to go for another opinion. And I went down to University of Penn Hospital, and I met with an oncologist named Dr. DeMichelle. And after talking with her and dealing with all that, I decided to do a mastectomy, double mastectomy. Prior to all this, they ran all kinds of tests. So before I got to University of Penn Hospital, they ran different tests, genetic testing, BRCA carrier. That's the one with Angelina Jolie, where she was BRCA tested and then wound up getting a mastectomy and her ovaries removed because she was positive. I was negative. There was also genetic testing for my hormones, and this is the testing that people say we want to see you be positive. And so I was in a sense lucky because I was triple positive. And triple positive means that you're receptive to the hormone receptor. So you are a candidate for chemo, a candidate for Herceptin, and a candidate for the medications that go along with, to prolong someone's life.
Okay, and you were talking about a BRCA. What is that exactly?
It's called the BRCA1 test, I believe, or BRC. I think it's BRCA. And what it is it's a genetic test to see if there's a link between breast cancer and ovarian cancer. And if you are BRCA positive, you are more likely to get ovarian cancer.
Okay.
I was BRCA negative, so my likelihood of that was slim, but I made a decision with my surgery. I chose to have a double mastectomy. Yeah. So with that, I had to meet with a plastic surgeon and a breast surgeon, aside from having to meet with the oncologist. The oncologist talks to me about the treatments to prevent cancer from coming back and to get rid of any cancer. The breast surgeon and the plastic surgeon are the ones that remove the cancer and then reconstruct.
Okay. And what was your initial reaction when you found out that you were diagnosed?
My initial reaction was shock, and even more so, how am I going to tell my kids? At the time I had twins that were 12 and a 13-year-old. And that was the most devastating part, is how am I going to keep a smiley face and hide this from them until I really had some answers. And I guess, meeting with them and talking with them was sort of secondary at that moment, because I needed to deal with it myself and my husband. Fortunately, they had a teacher that they were unaware of that went through the same thing probably 6 months before.
Okay.
And so I was able to contact the teacher and ask her if I was able to share that with them, just because she was doing so well. I thought it would be a nice opener to say, look how well she's doing, that's going to be me. And so that was totally fine. And when I told them about their teacher, they were in shock that she was ever sick. So it was a perfect opener for me. The fact that it was caught so early, I was very upbeat about it. I really didn't want them to worry. When the time came for me to get to face the fact that I was going to lose my hair, I decided we were going to make this kind of fun. So I hired their hairdresser to come over to my house, and she brought her scissors, clippers, everything. And so they all took part in destroying the hair that was on my head. Like, they just did whatever hairstyle they wanted before I got it shaved. And that made it, we were kind of really laughing about it. I have pictures. It was just sort of a memorable moment that took the fear away from them having to see me bald, and took the fear away from me having to shave it and come out and say, here I am, I'm a new person. So they took part in that and made it a lot easier for everyone. And it actually was, believe it or not, empowering. That was probably going to be the worst thing for me at the moment, and it wasn't that way at all. It really wasn't. It was like, I can do this. I came over that hump, and then the rest was, I had already had the surgery, actually. The hair thing came after. I'm talking a little bit out of order, but for me, that was the harder piece. So,
Okay, and how did you go about making the decision to do the double mastectomy?
I had been very large-chested, so the idea of trying to even me out if I was going to have a single, I didn't want them to match me in size. I was so skeeved at that point. I didn't want to deal with it at all. And I knew that reconstruction was not necessarily a bad thing. I know people that have gone through it, and I can speak now, after going through it, that I actually like these better than my old ones. It wasn't very difficult for me at all.
And who was your support system?
My husband, my parents, my in-laws, my kids, my friends, everybody.
Did they help you make the decision to do the double mastectomy, or was that all you?
No, that was my decision, 100%. They encouraged me when I said I wanted to do it. My husband especially, because men, they like breasts. What can I say? But everybody says, no, this is you. This is your body. You do what you want. And actually, every loved one of mine was like, do it.
Yeah.
Nobody cares at that point.
And so I know we talked a little bit earlier about the transition from your stomach fat into your breast. How did that work, and how did you become familiar with that decision?
Well, that was kind of interesting. When I met with the plastic surgeon, the first thing he did was he handed me a book, and he said, here, this is what we call it. And the book was titled Beauty After Breast Cancer. He makes it nice.
Okay.
And the whole discussion about how this would take place is kind of funny, because he literally has to squeeze your fat and say, oh yeah, you have enough fat to replace it up here. What size do you want to be? You know, and I was telling him, and he's like, yeah, we can do that, you know, or no, we can't do that. At first, he didn't think he was going to be able to make me a C cup. He said, I'm going to make you a B cup, and we were just like, whatever. Just make me healthy, make me alive coming out of the surgery. 9 hours of surgery is a little bit of a scare.
Yeah.
In fact, it's a lot of a scare. My husband's a respiratory therapist down at Penn, and he was giving the anesthesiologist the 3rd degree as far as what she was going to do and how she was going to get me out of the surgery alive, basically. But you know, I came through that with flying colors, and I mean, I have an incision from hip to hip. I had pain medicine that I had to take, but you know, everything, if you handle medication the way the doctors tell you to, and you treat your body with respect, and you do what they say, you're going to heal. And I went to physical therapy, and I recovered very, very well.
And how long have you been in remission for?
It'll be 3 years this October 26th.
Okay, and what can someone do to support someone who has breast cancer?
Listen. Don't act like the master, because people always have advice. The advice that we get as patients is the advice we get from doctors. And there's so much information out there on breast cancer and things you hear on the internet, and every person has their own tumor and has their own recipe for how to treat that tumor. So what I have is very different from a good friend of mine that was diagnosed at the same time. And she freaked me out when I was done my 4th round of chemo. She asked me what my oncotype was, and I didn't have an oncotype, but she wanted me to know, it was a whole nother thing for her.
Yeah.
And then I went to my doctor, and I freaked out, and I was like, what is this? Have I had enough chemo? You know, all this stuff. And they had to calm me down, and they were like, you are entirely different. Some doctors would argue, why did you even get chemo? You were at stage 1, you had a double mastectomy, you had all these things going on, and Penn was very radical, and the Herceptin, my tumor was HER2 positive, so it was a little bit more of a radical, aggressive cancer, so the Herceptin is another treatment to get it out of me. The reason that they do all that is because even though the tumor was at stage 1 and it was very, very small, it took the doctor had to wait. I waited at the doctor's office for 3.5 hours because they didn't get me my results right away. And it turned out that they had to wait for the results because it was going through a whole medical team of researchers, and they had a hard time finding the actual small area of cancer in the breast. So, but anyway, so everybody has their own regimen, and you know, it becomes difficult when you start hearing from everybody and all kinds of, from every angle, oh, well, this, you get really, it's hard enough when you hear the words cancer. Now you have to process everything, and it's best to listen to just the doctors.
Of course. And what would you say to someone that is diagnosed?
Pardon me?
What would you say to someone that would be diagnosed? What would your advice be?
Keep your head high. And there are new cancer cures every day. There are amazing people out there. I've been part of numerous studies down at Penn because Penn is a research hospital. If you want to be upbeat and you want to hear some positive voices, go to the oncologist, go on to the American Cancer Society, breastcancer.org, all these places. And then there's all kinds of conferences and speeches and all the innovative technology that's coming up and through, not just about taking care of the care of the cancer now, but the recurrence of breast cancer. Penn is doing a big study on that as well.
Of course. And how can people learn more about breast cancer?
It's everywhere. They can talk to people. They can get on all those websites I just mentioned. Everybody knows somebody that's affected by cancer, so I don't think it's a hard thing to learn about. If people want to come to me and ask me a question, I'm all ears. When I'll steer them in the right direction.
Okay, and last question, how has this changed your life today?
I live my life every day. Just to keep my head high, try not to stress. Stress is a big cause of cancer. This is a stressful job. I've learned to come into work. I get up early because I'm a morning person, so now I get to work at 6 a.m. and I leave at 3:15. I do my work. I work an hour and a half every day before work because that's how I deal, because by the end of the day, I'm spent. So that's one way I deal with my stress. I exercise. I stay positive. I keep myself away from negative people. Negativity, it does nothing but make you feel negative. And it's hard because we all have things that go on in our lives, and I'm not saying that I don't ever get in a bad mood or this or that, but just I try to keep myself in a positive state of mind, and I do things. I spend time with my family, I spend time with my friends, and you just never know when your time is up, so live your life.
Thank you so much. Is there anything else you'd like to add?
No, I just want to say that if anybody is afraid of this, it is a scary thing, but it's not the end of the world. And the surgeries are scary, but like I said, we can get through this. I do want to say that every woman out there needs to get a mammogram early, whenever it's recommended, 35 or 40, depending on your family history. Get a mammogram and do breast checks, but get a mammogram because that is the early detection is the best.
I just want to say thank you so much for coming and talking to us. It means so much to us.
You're welcome. Thanks for having me.
No problem. I'm Brianna Kelly here talking to Ms. Dampf about her survivor of a breast cancer. And remember that it is Breast Cancer Awareness Month. Now back to the Eagle's Eye.